What's a regular day like for you nowadays?
I work in London and am currently posted in the Outpatients Center for Managing Addictions, primarily opiates and alcohol. Services were initially heavily disrupted as the pandemic started to unfold. Face-to-face contact has reduced to some extent. I had been redeployed to an inpatient psychiatric ward for 2 weeks, and one could feel the intensity of the pressure on staff to keep up with rapidly evolving PPE guidelines to protect both patients and themselves. A lot of the staff working were Black, Asian, and minority ethnic groups, which is the group identified to be more affected compared to others for reasons not yet known. Although across the country there was news of PPE shortage and outdated or soiled PPE, thankfully most of the doctors I know did not face this situation, although we were always running thin on the ground for it. We were seeing a lot of patients who had a relapse of their mental illnesses due to reasons directly related to the pandemic, such as social isolation, reduction or loss of contact with their healthcare professionals and family, difficulty in organization of social care needs, and in some cases, possible mental health changes directly due to the COVID-19 infection.
What's an experience you'll always recall?
I remember assessing a gentleman in his 50s who had traveled across Europe and eventually presented as physically unwell and homeless. He was chasing an eminent antimicrobial research academician to contribute to the antidote for COVID-19. He was deluded and believed he possessed incredible scientific skills for which he won a Nobel. Many like him had hallucinations that could see the virus everywhere. Even though I tried to discuss their issues, my PPE gear, mask, apron and gloves only further fed into their paranoia.
And what's your message to the public?
Please adhere to your country's advice for social distancing and self-isolation. Do not shirk away from seeking help for physical and mental health emergencies, but avoid any unnecessary contact. And of course, wash your hands.